Happy Sunday. I'm Shamika, your nurse practitioner. I wanted to come back and talk to you about the subject of testosterone and low testosterone, how it affects men. I did a reel, a 1-minute reel, and that's just not enough time to get enough information in to really teach about the subject. So I wanted to come back and talk about how it affects men when their levels are low and what they can do to get those levels back therapeutic so they don't have to be discomforted by low testosterone levels. So testosterone is a hormone. It's primarily produced in the testicles of men. Testosterone is responsible for strong bones, muscle mass, muscle strength, facial and body hair, red blood cell production, sex drive, and sperm production. Testosterone decreases in men each year after the age of 30. So after the age of 30, testosterone starts to decrease by 1% every year thereafter, after 30 years old. And a level of 300 nanograms per deciliter is considered low. So that 300 nanograms per deciliter, nanogram per deciliter, that's medical jargon. I'm going to toss that out. The top number is 800. So a high level of testosterone in a man's blood is 800. A lower than normal level on a blood test can be caused by a number of conditions, but the number one thing is aging. Other things are testicular cancer, treatment for testicular cancer, hormonal disorders, infections, HIV or AIDS, chronic liver disease, chronic kidney disease, type 2 diabetes, and obesity. Obesity is the mother of so many things. Obesity. Some medicines, some medications, and genetic conditions can also lower a man's testosterone levels. And of course, like I said, the aging process is the number one cause. Low testosterone levels often lead to drops in bone density. So what does that mean? That means that the bones become fragile and they break so easily. Like I had a guy that hit his arm on a table and broke his wrist. And I'm like, what was that? So your bones break really easy. Also, low testosterone levels cause hair loss in men. It causes them to develop breasts, which is called gynecomastia, moodiness, anger for no reason, irritability for no reason, depression, forgetfulness, insomnia, low sex drive, erectile dysfunction, and fatigue. And it's not for no reason. It's because those levels are low and they don't know, the man don't know just how low those levels are. So when should you see a doctor? Talk to your doctor or your nurse practitioner if you think you have low testosterone levels, or if you're experiencing symptoms like decreased sex drive, erectile dysfunction, muscle loss, hot flashes, or fatigue. Your practitioner can test your blood levels to determine if you have low levels and can develop a personalized treatment plan to address your needs. To test your testosterone levels, it costs about $56, give or take, if you don't have health insurance, and that depends on the lab. But of course, if you have health insurance, you can get it for free. Okay. Ways to increase your testosterone levels naturally is to lift weights, eat a high protein diet. I read a few studies that said the ketogenic diet increased men testosterone levels. You could minimize your cortisol, the stress hormone. I did another video talking about the negative effects of the stress hormone, cortisol. So another thing that cortisol does is it decreases testosterone levels. You could also take vitamin D and get you some sun, get high quality sleep, 6 to 8 hours. If you work at night, then you should be sleeping 6 to 8 hours in the daytime. And last but not least, you get testosterone boosters like ashwagandha. That's a tongue twister too. Ashwagandha. Other natural ways to increase your testosterone levels with research proven its efficacy is saw palmetto, DHEA, which is a hormone, zinc, which is a mineral, vitamin D, which is actually a hormone, but we call it vitamin D. Go figure. Ashwagandha, fenugreek, and ginger. But the fastest way to increase your testosterone levels is actually testosterone supplementation. And testosterone supplementation can be administered via IM injection, intramuscular injection in the arm, topicals and creams, topical creams and gels, oral medication, and pellets. There are HRT clinics out there that could help, and an HRT clinic is hormone replacement therapy clinic. But before you go there, you got to go to your doctor or your nurse practitioner, and you got to speak with them, because like my friend Louis said, there are other things like high blood pressure symptoms mimic low testosterone levels, or a man that has diabetes and his blood sugar has been running high, he doesn't know it. Those high blood sugars mimic low testosterone levels too. So before you do any supplementation, before you do anything, try to get you a level. Try to get you a testosterone level. I am a huge advocate for getting your labs drawn, for knowing what's going on inside your body as well as outside your body. But I believe knowing what's going on the inside of your body is just a little bit more important, because you can't see the inside of your body. So get you a testosterone level. It's about $56. Again, give or take a few dollars depending on the lab. And if you have health insurance, you can get it for free. Thank you so much. I hope this was helpful. Have a great Sunday. Peace.